here with me is Dr. L. Swastichan. He is additional DDG in the ministry, and he's looking after the program. And we have Dr. Alok Mathur sir also. He has joined this division, and along with me, the whole NPNCT team is over here, and we have our keynote speaker over here, Dr. Kameshwar Prasad sir, who has joined online. So, because today's session is very tightly packed, so we won't be taking much time. So, I request Dr. L. Swastichan sir to kindly give the keynote address to initiate this webinar formally. So, over to you.
Good afternoon, friends. Good afternoon, Dr. Kameshwar Prasad sir, and our colleagues who have joined here physically, and those of you, many of you, more than 500 clocking now, about 600 going to be, and who have joined online. Today is another exciting day for all of us. We are continuing our fortnight webinar from the NCD division of the DGHS in the Ministry of Health and Family Welfare. Today, we will be discussing very important topic on the eve of the World Stroke Day. Friends, the other day, the last week, I was in Gandhinagar, with the ICMR team, trying to work out the best pre-hospital care. And in that meeting, we were trying to figure out at what duration we can reach the patients who could be suffering from emergencies, including stroke and the ST elevation myocardial infarction. And we were thinking about 10 minutes, 5 minutes, 7 minutes, 20 minutes, etc. And I realized how important are those 10 minutes, 15 minutes, and 20 minutes, etc., which we are struggling with in the traffic, which we are struggling with ensuring that the right ambulance comes at the right time, and also with the right paramedic, and they are taken to the right hospital. Everything needs to be right during that time. Then that also, helps me think that, if you don't take care of the right ways of living, right ways of avoiding the risk factors of the NCDs, we won't be able to, survive if we only rely on those 10 minutes. So that gives us the importance of, recognizing whether we are suffering from hypertension or diabetes, etc., and also whether we are taking care of these medicines by putting ourselves on standard treatment guidelines, etc. And are we monitoring ourselves together? Nevertheless, we have 1.4 billion people. Some of us would be will be in that area of risk factor. Some of us will be having that disease with us. We need to screen ourselves, and some of us would be on treatment, and we need to continue to do that treatment as well. So this is very important topic, and we will go ahead with today's program and also listen to the experts. We won't dwell into the nitty-gritties of the expert advice in front of sir, who is Padma Shri and also a renowned figure in the field of stroke care in this country. So Sikha, we can go ahead with the next part of the program.
Thank you, sir. Before going to the Kameshwar Prasad sir, I would like to give a glimpse of a video. We have observed a World Hypertension Day on May 17th, and the purpose was to raise awareness on the prevention, detection, and effective management of high blood pressure. And this year, we have marked the occasion by launching a nationwide webinar wherein nearly 9,000 participants had joined. And we had introduced 3 educational videos as well as 4 informative posters providing essential insights on hypertension, control, and lifestyle management. Sir, we would like to play a video where states have participated,
Yes,
states and various organizations have participated. Please play the video.
Please confirm the sound if it is audible.
Yes, it's audible.
Okay, yeah. Thank you.
High blood pressure is India's #1 cause for heart attack and strokes. People were told they have high blood pressure, which puts them at risk of heart attack, stroke, and kidney failure. Their doctor gave them medicine to keep their blood pressure under control. Most took it and continue to take it. Some did not.
Your medicine don't take.
Thank you, team. Now, I again request Dr. L. Swastichan sir to kindly announce the result based on these feedbacks and the results reports which we have received over here. Over to you, sir. Can we have the PPT for the result?
Thank you, Sika. And as evidenced
allow
by the video, we had a month-long awareness campaign on hypertension on the eve of the World Hypertension Day. Duration was from 17 May to 17 June 2024. And now I have the privilege to announce the best performing states, UTs, as well as the institutions. During this, next please. During this campaign, entire campaign, which was done nationwide, we had issued letters to the states, to the medical colleges, dental colleges, and nursing colleges, and accordingly, we had received a report based on the performance as per an indicator-based list. Next, please. 212 reports were received, 7 from AIIMS all across the country, 91 from the nursing colleges, 78 from the medical colleges, 25 from the dental colleges, and 9 states and UTs had submitted a report. So based on a scoring criteria constituted by a committee, we have adjusted the best performers. Next slide, please. Among the states and UTs, we would like to announce that the first rank goes to Meghalaya, followed by West Bengal in the second rank, and Arunachal Pradesh in the third rank. And in terms of the contribution, the committee had also decided that the UT of Daman and Diu would also be given special recognition. So congratulations to all the states and UTs. Next, please. Among the AIIMS New Delhi is ranked first, and AIIMS Chhattisgarh is AIIMS second, and AIIMS Raebareli UP is ranked third. So congratulations to all these AIIMS. Next, please. And among the medical colleges, Banas Medical College, Gujarat is ranked first, followed by SKMCH, Muzaffarpur, Bihar, second rank, and Dr. MGR University, Chennai is the third rank, and Lady Harding Medical College is also adjusted at the third rank. So we had third rankers, and we congratulate all the medical colleges for this great performance. Next, please. Among the dental colleges, we are happy that the dental colleges had also participated well in this World Hypertension Day related celebration, and Sri Balaji Dental College, Chennai is ranked first, followed by Genesis Institute of Dental College in Punjab and Krishna Vishwa Vidyapith Satara in Maharashtra as the third rank. So congratulations to all these dental colleges. And next, please. And among the nursing colleges, Sarda School of Nursing College is adjusted first, then Al Sifa College of Nursing in Kerala as the second, and the Prem Institute of Medical Science, Panipat, as the third rank. So these are the best performers, and we congratulate each one of them, and we would be giving participatory certificate to all. And on an occasion, we are going to call these performers for giving them the certificate. Sika, is that the plan? Okay, thank you very much, and we are happy that we had a very great month celebrating World Hypertension Day, highlighting the need of hypertension. And if we do not do it, that is why we're here today on World Stroke Day to discuss one of the complications of uncontrolled hypertension. Next program to you, please.
Thank you, sir. Now I take the opportunity to invite Dr. Kameshwar Prasad sir for deliberating on World Stroke Day, awareness and prevention of stroke. Sir is a renowned emeritus professor of neurology from AIIMS, New Delhi. He is principal director and head for neurology in Fortis Hospital, Vasant Kunj. And to add on to it, sir, he was a former director and CEO for the Rajendra Institute of Medical Sciences, Ranchi, and he has been a member of the WHO Strategic and Technical Advisory Group, Mental Brain Health, and he is also a member of Multiple Sclerosis International Federation, and he has also contributed as a nominated editorial member board member of British Medical Journal Practical Neurology. Sir has been a former editor for the Cochrane Stroke Review Group, and he has more than 400 publications in 21 books and chapters, and he has been the editor-in-chief for Bickerstaff Neurological Examination Clinical Practice, and he is also the author of the book, namely Fundamentals of Evidence-Based Medicine. And in the awards, there are so many, but I'm going to just name a few. That is, he has been elected as a fellow for the National Academy of Medical Sciences. He is the national coordinator of many international stroke trials and national DBT stem cell study in stroke. He has been given the Educational Achievement Award for consistently highest rated workshop faculty from 2002 to 2018 from the McMaster University, Canada. He has also received the Years of Service Award for 15 years for passion and dedication to evidence-based medicine education from National University Hospital, Singapore. And to the most which is being good for any citizen is he has been awarded a civilian honor, a Padam Shri by the Honorable President of India. So over to you, sir.
Thank you, Dr. Shikha. Thank you, Dr. Swasti Charan and Dr. Shefali and all the team with Dr. Swasti Charan who are in the Nirman Bhavan. Can you hear me well?
Yes, sir, we can hear you well, sir. Please continue.
Right. So what I'm going to do is share my screen and already, I think, yeah, right. Right. So I'm going to just talk about some basics and prevention of stroke and a little bit about what to do when you see a patient with stroke.
So we are unable to see your screen.
Oh, okay. So I have to.
So there is a green option of share. You can try from there.
I'm trying to.
Else I can share a screen on your behalf as well.
I can share. No
Okay,
problem.
please, sir.
I thought.
It's visible.
Yes, sir, it's coming, sir. Maybe in the slide mode now, sir.
Now you can see that.
Yes, sir. Yes, sir.
Yes.
Okay.
Please.
Please go ahead.
Stroke word everybody has heard, and I think they generally hear when cricket is being played anywhere in India or abroad, and stroke usually you hear when people are batting, and that is when everybody talks about good stroke and not so good stroke and so on. And this comes in newspapers often. 20 years of cricket, different strokes for different folks. We are not going to talk about cricket here. We are going to talk about a medical problem which is called stroke. It is a problem which is related to blood vessels going to the brain. So all of you can see that there are 4 major blood vessels going to the brain, 2 from front, 2 from behind, and they go and branch into many branches, which is like a tree to supply every part of the brain. So you can see this from the front, from the back, and lower down is heart, and then the big arteries, and then branches which are going into the brain. And when the blood goes there, it has to come back. So coming back happens with what is called veins of the brain. And any of the blood supplying channels, whether it is arteries going to the brain or veins coming, bringing blood back to heart from the brain, there can be a problem. And stroke occurs when there is problem with the one of the arteries or veins, whichever is getting affected. Now, we also call stroke as brain attack because it happens suddenly. And in Hindi, उसी को लकवा कहते हैं या पक्षाघात भी कहते हैं और अधरंग भी कहते हैं. तो ये these are all synonyms. लेकिन attack word से यह पता चलता है कि that stroke happens suddenly. So suddenly, if something happens with the circulation of the brain, then that is called stroke. And depending on which area of the brain is affected, right, it is going to be manifesting in different symptoms and signs. तो जो भी एरिया में ब्लड नहीं पहुंचा वो एरिया काम करना बंद कर देगा. So that is what is the signs and symptoms of the brain. So जैसे हमने बताया कि there are two kinds of vessels, arteries bringing blood from heart to the brain and veins bringing blood from brain to the heart. So stroke भी उसी तरह से are either because of artery problems or because of problem in the veins. But when we look at stroke, this is 2008 slide. Now they say that there are at least 12 lakh stroke every year in India. And venous stroke, जो veins के problem से होती है, usually happens in pregnancy or after delivery. And one of the two of the important things is smoking and oral contraceptive use, which is likely to affect clotting in the veins. But we are going to talk mostly about arteries because ये बहुत कम होता है, इसका बहुत बड़ा problem नहीं है. So in artery, for general people, I say that it is like pipes going to your home supplying water. In this case, pipes are going to the brain supplying blood. So in your home, what are the two kinds of problems you face in your water pipes? कभी ब्लॉक हो जाता है और कभी लीक होने लगता है जब आप प्लम्बर को बुलाते हो. So blockage type and leakage type, यही दो चीज यहाँ भी होता है. So blockage type of stroke is because a blood clot blocks the flow of blood to the area supplied. And leakage type is when blood leaks out of the artery because there is some break in the arterial wall. So ये दोनों medical terms में they are called ischemic stroke. Blockage type is called ischemic stroke. Leakage type is called hemorrhagic stroke. बहुत लोग बोलते हैं blood vessel burst कर जाता है. Burst बड़ा frightening word है, इसलिए मैं कहता हूँ कि leak कर जाता है. And that is what gives rise to hemorrhagic stroke. अब इसमें से ischemic stroke ज्यादा होता है. About 70%, 75% ischemic stroke होते हैं. Hemorrhagic stroke 20-25% होते हैं. इसलिए ज्यादा टाइम हम लोग ischemic stroke में बिताएंगे. And we'll talk about blockage type of stroke. So here, this is one example. Like you can see that a clot has blocked the artery and therefore flow of blood to the part of the brain which you see like black is affected. That part of the brain gets damaged, and that is what is causing symptoms and signs. And very quickly, as you can imagine, we can also remove this clot or dissolve this clot to again allow blood supply to that part of the affected brain. We will come to that later on. And blockage type and leakage type have different treatments. Has to be, because in one you have to remove the block, and in the other one you have to do something about the leaking blood. So how do you know which is the one? Now, which one is there in your patient? CT scan is the choice or investigation of choice. You have to do CT scan to find out blockage type of stroke or leakage type of stroke. So the blockage type of stroke will usually give rise to black area, as you can see in the lower parts of the CT scan. There is black area on the right side, which is because of blockage type or ischemic stroke. And here you can see that blood is leaking out, which is causing bleeding inside the brain, that is what is called hemorrhagic stroke, and that looks white in the CT scan. Again, very easy to make out whether this is hemorrhage or not. So white and black, these are the two colors which will tell you in CT scan whether it is ischemic stroke, which is manifesting as black, or hemorrhagic stroke, which is manifesting as white collection. And I told you that most common is ischemic stroke. Now the question is, why does it happen? If we know why does it happen, we can prevent it or we can treat it. So usually it is because blood vessel, and I'm talking about blockage type of stroke now, blood vessel gradually narrows down. So if it is this big, it will gradually become narrow, and therefore the lumen, or you can say area of the blood supply within the artery will become narrower. So that is because of deposition of fat, and that happens over a period of years. And those who have high blood pressure or those who have diabetes, they are more prone to developing this narrowing of the artery, which is called stenosis. And this goes on gradually over a period of years when the artery becomes very narrow. I will show you another picture for that. And sometimes heart, which is also weak or some other cause, which is heart attack or something, there is blood clot formation. There may be valve disease, which will also promote blood clot formation, and that clot will get detached and go to the brain artery and block it. There are some other diseases also which can increase blood clot formation. So you can see a normal artery on the left side and how gradually over a period of years, there is deposition of what looks yellow, which is the mostly fat, which is causing narrowing of the artery, so much so that it becomes so narrow towards the end that the blood may clot there and completely block it. So somebody asked, when does it begin? People have seen in research that even at the age of 3 years, it starts happening. Initially in the form of lines, and then gradually it goes on obstructing the lumen of the artery. So it goes on and on and on. So don't think it has happened on the day of stroke. It has happened over the years. That's why, as Dr. Swasti Charan was saying, that you have to think about controlling high blood pressure, diabetes, have your diet proper, and we'll come to that later on. And once it is narrow, then as you can see, there can be some problem within the lumen, which will be completely either blocked, or the fat which is deposited there may be bleeding inside it, which can also cause sudden closure of the vessel, and that is why people develop stroke. So you can see that artery going to the brain in the lower part you can see, and in the upper part you can see the clot, how it is getting stuck into the branch of the artery, and that is why there is no blood flow further, and that is what it causes dysfunction or damage to that part of the brain, leading to blockage type of stroke. You can check that in MRI or CT angiography. You can see on the left-hand side, there is beautiful artery. On the right-hand side, you can hardly see the arteries. That is because of the narrowing, and maybe some part of it is clotted. So the question is, who is at risk of developing stroke? That we define by what is called risk factors. Risk factors means those who have this, they are at increased risk of developing stroke. And the most important risk factor, which is modifiable. Some risk factors are not modifiable, like age, sex can't be modified, family history can't be changed. But there are modifiable risk factors, which we must remember. And one of the most important, or the most important modifiable risk factor is high blood pressure. So I'm happy to see the video that you have talked about. The second very important is smoking. Third is high blood sugar, which is like called diabetes, is those people who suffer from high blood sugar. And the other is heart disease. Sometimes heartbeat may be very irregular, and it is called atrial fibrillation, which is also a risk factor. Of course, weight, overweight, or abdominal obesity, as it is called, that is also a risk factor. Excessive use of alcohol is a risk factor. Improper diet or imbalanced diet, which is rich in salt and saturated fat, is also a risk factor. Physical inactivity is a risk factor. Of course, it increases your weight and increases blood pressure as well. And also, it won't allow you to control your diabetes. So physical activity is there, diet is there, smoking, all the factors which we talked about, including high cholesterol, these are the risk factors. So the question is, those who are at risk factors, who have the risk factors, what symptoms they will develop. So you will see that there is maybe a minor or major stroke or a mini stroke. So to remember that, in Hindi, we have discussed in the ministry and said, remember one phrase, हाथ पैर बोलचाल देखना और दिखना. हाथ में अगर अचानक कमजोरी हो गई या सुन्नापन हो गया, पैर में अचानक कमजोरी हो गई, सुन्नापन हो गया, या बोलचाल, बोलने में लड़खड़ाहट हो गई या बोलना मुश्किल हो गया, या चलने में लड़खड़ाहट हो गई या चलना बैलेंस लूज कर गए, तो हाथ पैर बोलचाल देखने में दिक्कत हो गई, चाहे आंख से कुछ नहीं दिख रहा है, एक आंख से, कभी कभी दोनों आंख से कुछ नहीं दिख रहा है, या नहीं तो दिखना, आपका फेस टेढ़ा दिख रहा है, आप शीशे में देख रहे हैं, फेस टेढ़ा दिख रहा है. सो हाथ पैर बोलचाल देखना और दिखना, इसमें अगर अचानक कोई प्रॉब्लम हो गई तो आप समझिए कि परहैप्स ये स्ट्रोक ना हो. लेकिन अगर कुछ देर के बाद ठीक हो जाता है, इफ इट improves within minutes, at the most in an hour, sometimes it takes 24 hours, it is called transient ischemic attack or mini stroke or warning attack. So ये warning symptoms और stroke के symptoms लगभग सिमिलर होते हैं, एक्सेप्ट दैट आंख से देखने में दिक्कत और वो ठीक हो जाना, इसको स्ट्रोक नहीं बोलते हैं. दिस इज कॉल्ड टाइप ऑफ वार्निंग अटैक कॉल्ड हेमोरेसिस फ्यूगैक्स. सो दैट इज व्हाट इज वन ऑफ द वार्निंग अटैक. सो रिमेंबर दिस. इन इंग्लिश it is called be fast. B stands for balance, E stands for I means vision, fast, F stands for face becomes asymmetrical or something looking awkward, and A is for arm and S is for speech. So if any one of the balance, vision, speech, face or arm weakness happens, then you should act, time to act. That is why T is there. So be fast is in English. हाथ पैर बोल चाल देखना और दिखना in Hindi, remember, are the key to warning symptoms of stroke. So just to repeat it, trouble walking, weakness of one side, trouble seeing, trouble speaking, and the symptoms, other symptoms depend on which area gets affected. So for example, if there is an area for language, for hearing, for vision, for movement, for sensation, depending on which area is affected, you will get symptoms and signs. And we have talked about this. But one thing which we should remember for leakage type of stroke, all of this was about the blockage type of stroke or ischemic stroke. In leakage type of stroke, we say that if somebody gets sudden severe headache, which is of so severe that never experienced before, it can be a warning attack of hemorrhagic stroke or leakage type of stroke. So you have to go to the doctor, get a CT scan done immediately. It may be okay, but it should be done so that you can rule out hemorrhage. And other things we have talked about, weakness of the face, numbness, tingling, or vertigo, or vision problem, balance, and other things. So this is what I wanted to tell you. I have already talked about this. Unexplained imbalance or double vision can also be one of the symptom of warning symptom of stroke. But once a stroke happens, you should remember that a lot of people, about 1/3 people don't survive. And 1/3 people become disabled and 1/3 recover. So it is quite a devastating disease. I think it is improving now. Survival is improving a little better, but still, I would say that it is such a devastating disease that treatment, prevention is better than treatment. But if someone develops it, you have to immediately shift him to a place where there can be CT scan and treatment like clot dissolving medicine or clot removal. So you have to move them to tertiary hospital. But as I told you, prevention is better than cure. So what to do about that? First thing is no smoking. Those who have not started, don't smoke. Those who have started, they should stop smoking. This cannot be overemphasized, and this is one of the most important thing which can be done. Of course, check blood pressure regularly. We say that those who have crossed the age of 20, or let's say any adult for that matter, certainly after the age of 25, always at least once a year check your blood pressure. And if you have high blood pressure, first the doctor will like to control without medicine, with exercise and salt restriction. But if it doesn't happen, then take medicine and take it regularly. Even if blood pressure becomes normal, you have to continue to take it. And one thing I must say, that it is a silent killer. Don't wait for headache to develop before you diagnose blood pressure or you think your blood pressure is high. It has to be measurement of blood pressure, even if there is no symptom. So it is called silent killer. Remember this. Of course, green vegetables and as you can imagine, fruits. These are the two things which you should increase. And saturated fat or trans fat, मतलब तली हुई चीजें जो होती है उसको जो है कम करना है, बटर घी कम करना है, और ये सब चीजें जो फ्रूट्स और ग्रीन वेजिटेबल्स है उसको बढ़ाना है, सॉल्ट को भी कम करना है. सो डाइट इज अनदर वेरी इंपॉर्टेंट थिंग फॉर प्रिवेंशन. उसी तरह से अगर किसी का हाई ब्लड शुगर है तो हाई ब्लड शुगर को कंट्रोल करना, either you do without medicine or with medicine. Of course, your doctor will tell you what is to be done, but you have to control your diabetes. Regular exercise, very important. We say that at least 30 minutes of exercise 5 days in a week is a must. But I think those who do more, they will get more benefit. But without physical activity, means physical inactivity is also a very important risk factor for development of stroke. Of course, stress is another very important thing. These days, there are so many factors causing stress. So stress management, yoga, for example, pranayama, meditation, this and many other factors. Sometimes people like music or playing or whatever you like. You have to do some stress management because very many people are undergoing stress. So if you control all the risk factors, that doesn't mean all strokes can be prevented. We say that after controlling all the factors, still there will be some patients who will develop stroke. And that is because there may be many other risk factors. There is one risk factor called, for example, obstructive sleep apnea, that is related to sleep. We are not talking about those risk factors which are less common, but there are. So there are the diseases which can promote clotting. So strokes will keep happening in spite of all control of risk factors. Therefore, you must recognize the symptoms and transfer the patient to nearest hospital where CT scan is available at least. And there is possible to do the scanning, find out which type of stroke is there, and then accordingly management can be done. So if you do everything, there can be happy ending. There are many patients who recover completely, and therefore, even if stroke develops, there is a need to take the patient immediately to nearby hospital. Thank you very much. I hope I have covered the necessary things, but there are many questions. I'm happy to take questions.
Thank you very much, sir. You have very well covered the presentation, the topic on stroke, covering all the aspects from clinical feature, risk factors, and the prevention and the basic management. However, we invite participants to put their questions in the chat box so that those questions can be addressed timely by sir. So kindly post it on the chat box. Yeah, question and answer in Q&A.
Please throw some light on the management of both types of stroke. So, as I told you, if there are symptoms which are like stroke symptoms, I have already talked about that, then you better take the patient to hospital. Suppose it is blockage type of stroke, they will be able to find out and use medicines to dissolve the stroke if you reach within 4.5 hours. So it's very important to reach as early as possible. And if you reach within 4.5 hours, the clot dissolving medicine can be given. That will dissolve the clot and therefore blockage will open. Sometimes a large vessel is blocked, then that has to be removed. That there is a process for that, removing the clot through using stent retriever. Sometimes these are not possible because people don't reach within 4.5 hours. For clot removal, it can be within 24 hours also. But if they don't reach on time, then there is antiplatelet blood thinners which are used, and simultaneously control of BP, sugar, fever, infections, and management of swallowing. These are very important. Of course, physiotherapy is very important for management of blockage type of stroke. And in the leakage type, of course, apart from managing the pressure inside the brain, which requires sometimes surgery, and managing the blood pressure, all the complications have to be managed just as we manage any stroke patient.
Sir, there is
Any
a question regarding what should be done for the management at the sub-center level.
Right. At the sub-center level, most important thing is first, of course, to manage the risk factors, prevention, as I talked about. But if somebody develops a stroke, then as soon as you recognize it, you have to find out one of the two things. Number one, is it mini stroke? Has he recovered? Some people come to you after they have recovered. So they had sudden blindness in one eye, which recovered over 5 minutes. Or somebody had suddenly difficulty in speaking and recovered. If the patient has recovered, then you can start straight away on aspirin and send him to some hospital where further checking can be done, particularly looking at heart and looking at any narrowing of the arteries and so on. But you can start aspirin even before CT scan in patients who have recovered, because it is unlikely that there will be bleeding, very unlikely. But if somebody has deficit which has not recovered, then you don't start, you send him to a hospital where CT scan can be done, and depending on the type of stroke, aspirin may or may not be started. So that is something which can be done at subcentral level. Of course, if a patient has high blood pressure, you must treat high blood pressure. But at the same time, you should remember that when stroke happens, we don't treat aggressively. So don't bring it down to 130 by 80. We want blood pressure to be slightly higher in acute stroke. So you may not initiate treatment for blood pressure. Send to the higher center. Their blood pressure, diabetes, everything will be controlled. But you can start aspirin in those whose symptoms have recovered.
Thank you, sir. There's one more question regarding stroke in frontal lobe causes speech and intellectual problems. What is the management?
Right.
See,
So left frontal lobe in right-handed people is the site of speech. So if there is damage there, speech will be lost and there will be weakness of the right side. One thing you should remember, and perhaps doctors know, ASHA workers may not know, right side of the brain controls left side of the upper limb, lower limb, hand and feet, and left side of the brain has right control of right upper limb, right lower limb, and those who are right-handed, speech is on the left side. So good question. When speech gets affected, treatment for stroke of this type is also same as I discussed in general about blockage type of stroke. But if speech is affected, then speech therapy has a big role, which of course Patients may start improving within few days, but after patient recovered to an extent, speech therapy can help to recover speech. But there are other medications which we use so that we can expedite improvement in deficits, physiotherapy for limbs, speech therapy for speech. So there is a question. Can we use aspirin along with clopidogrel? Good question. If it is a patient of blockage type of stroke or ischemic stroke and it is minor, and that you should know that when we see stroke patients, we divide them into mild, moderate, severe. हिंदी में समझिए, हल्का स्ट्रोक, मीडियम स्ट्रोक या बहुत गहरा स्ट्रोक. माइल्ड वालों को आप डबल एंटीप्लेटलेट देते हैं, एस्पिरिन प्लस क्लोपिडोग्रेल. यू कैन स्टार्ट राइट अवे. Clopidogrel 300 milligram loading dose followed by from second day 75 milligram, whereas aspirin you can straight away start with 75 milligram per day. But if it is moderate, then we have to talk about clot dissolving, clot removal, and so on. That is not necessary for mild stroke. Remember, mild stroke के लिए clot dissolving drug और clot removal की जरूरत नहीं है. मॉडरेट वाले की जरूरत है. बहुत सीवियर वाले को भी जरूरत नहीं है, बिकॉज उसमें ब्लीडिंग का खतरा ज्यादा है. सो क्लॉट रिमूवल हो सकता है. दैट इज इन द हायर सेंटर, सो यू कैन रेफर टू हायर सेंटर्स.
Sir, there are few more questions like, can severe chest infection be cause of stroke in a patient who is on antihypertensive medication? If yes, kindly explain.
Well, infection is also a risk factor. So we say that now more and more studies show that atherosclerosis, which is the main pathology of stroke, is actually inflammatory disease. So infections also contribute to development of atherosclerosis. लेकिन infection या pneumonia हो जाने से stroke होगा, that is possible coincidence, but it is not the cause and effect that अगर pneumonia हो गया तो उससे stroke हो जाएगा. But yes, there is some contribution of infections in general in development of atherosclerosis, not to precipitate stroke unless there is very low blood pressure because of septic shock, and there is narrowing. In that case, a patient may develop stroke because narrowing will close and it will get blocked. Any other question?
Sir, there are so many questions, but they have been covered in the PPT. So please post your question. We will try to answer them to you back with the revert email. Sir, any golden words you want to say before closing this webinar?
Before closing, I'll say a risk factor, always modifiable risk factor. I say 4+4 याद रखिए. 4+4. 4 related to lifestyle. उसमें हम बोलते हैं usually खान पान, diet. We have already talked about that. पीना में alcohol excess to be avoided, cigarette पीना to be avoided, and any tobacco should be avoided. उसी तरह से physical inactivity to be avoided, overweight to be avoided. These are the 4 things about lifestyle. And 4 diseases. Diabetes, high blood sugar, high blood pressure, which is hypertension, high cholesterol, and heart disease like valvular heart disease or atrial fibrillation. So 4+4 याद रखिए. There are other risk factors also, लेकिन 4+4 याद रखेंगे तो उससे आप जो है सारे रिस्क फैक्टर याद रखेंगे, कंट्रोल करेंगे. उसको हमने निमोनिक एक बना दिया है. वो बोला है कि दीदी टॉप्स बीएससी ऑनर्स. याद रखिए, दीदी टॉप्स बीएससी ऑनर्स. दीदी डाइट एंड ड्रिंकिंग को दीदी हो गया. टॉप्स टी फॉर टोबैको, ओ फॉर ओबेसिटी, और एस है वो स्लीप भी होता है कि दैट इज ऑल्सो ए प्रॉब्लम समटाइम्स. और बीएससी ऑनर्स क्या हुआ? बी से ब्लड प्रेशर, एस से शुगर, हाई ब्लड शुगर, सी से कोलेस्ट्रॉल. बीएससी ऑनर्स में एच है ना, हार्ट डिजीज. तो अगर आप याद रखिए दीदी टॉप्स बीएससी ऑनर्स, तो सारे रिस्क फैक्टर्स कवर हो जाते हैं. और हिंदी में आपको बता ही दिया है, हाथ पैर बोलचाल देखना और दिखना. इससे आप जो है पकड़ लेंगे कि किसको रिस्क फैक्टर है, किसको हार्ट स्ट्रोक हुआ है, एंड देन यू कैन अकॉर्डिंगली मैनेज.
Thank you very much, sir. I think if we would have been in the medical college still, so it would have been really helpful for me to remember all these mnemonics. So, with all these remarks, I would like to close this session, and I would like to extend my thanks to Dr. L. Swastichan, sir, for sparing his time for this webinar, Dr. Alok Mathur, sir, for being here with us, and all the team over here present in this hall, as well as the participants who have joined online, and the ECO team for providing all the support. Thank you. Thank you.
Thank you.
Before we
Thank you.
close, we
Thanks
would
to-
like to thank Professor
Yes.
Kameswar Prasad, sir. You had been a star, and we had very much enjoyed a very difficult topic.
Thank you very much for giving me
simplified for all
opportunity,
of
and
us.
thanks to the ECO
Thank you
team
so
as
much,
well.
sir. Thank you
Thank
very
you.
much, sir. Please continue to join us in future webinars, sir. Thank you.
Sure. Thank you.